Marvin Plackett, and today is Monday, June 8th. Greetings to all residents, to all staff, and to all guests. I'm pleased to report that we have no new confirmed COVID-19 cases. I am also saddened to report that we have had one more death from COVID-19, a resident that lives at Episcopal Church Home. That now brings the total deaths from COVID-19 to 3. Every one of those situations, of course, it is sad that that has occurred. As you well know, 80% of the deaths in Minnesota have been those that are living in long-term care, those that are living in nursing homes and or assisted living. And of course, primary reason for that is that's where the frailest in our society are living, is in nursing homes and assisted living facilities. And so that's where our 3 deaths have occurred. The residents already, of course, were rather frail when they did contract the COVID-19. I'm pleased to report that one of our staff members is fully recovered and is back on duty here at Episcopal Church Home. So given these updates, we now have 19 confirmed COVID cases. 8 are residents and 11 are staff. And those 8 residents, of course, are on our dedicated COVID-19 unit at Episcopal Church Home. At Iris Park Commons, I mentioned that last week there was testing on Tuesday and Wednesday. Total of 102 tests were administered, and we have 101 results. All are negative. That is really outstanding. Just one test result is yet to be received by us, and we expected it already, but it isn't here. Should be here today or tomorrow. Gradual reopening. As you know, starting Wednesday, just 2 days from now, Governor Walz has made the change that Minnesota is going to move to phase 3, which is largely a reopening of almost everything in Minnesota with restrictions, with limitations. The capacity of restaurants and the wearing of masks by restaurant workers, and there's a list of things list of rules that apply to the various retail settings, restaurant settings, bars, etc. And so with that gradual reopening, we here at Episcopal Homes, for our independent living communities, because right on our campus, we have 4 independent living communities. We have 3 that are part of what's considered by definition in the state of Minnesota, the health department, long-term care, as in we have 2 nursing homes and 1 assisted living. And the other 4 communities on our campus are independent living. And then our community at Dalen University, King's Crossing, that's independent, as well as Carty Heights, which is at Lexington University. So we are in the process right now of modifying our rules and requirements for our independent living communities. So within a couple of days, you're going to be seeing an update from us pertaining to those changes, and asking also for your feedback on those changes. So be watching for that. It will be coming to you through the manager of your community. Some of you have taken note of the roundtable on racism that I am going to get going here at Episcopal Homes, that I'm going to initiate. And some of you have expressed interest in participating. Others of you have said that you were maybe going to, Nell, thank you for your note, that you were going to, in fact, get something going with some additional residents, but you're going to wait and see. Well, I have not yet figured all this out, but I am right now searching for a person or an organization to help me facilitate this. And whether we have a roundtable on racism that is dedicated solely to staff and a different one to residents, or have a combined or a hybrid between those options, remains to be seen. What I will tell you is that I'm not going to delay initiating this work. It is important. Certainly in our society, the tragedy that has torn open the wound of racism once again, it has not died down throughout the United States and throughout the world. It has changed form here in Minneapolis and St. Paul, but certainly the dramatic, which I say crowds, and the vocal nature has not changed. It has not diminished to any significant degree, and in places it's growing. So I am not going to delay with initiating this roundtable on racism, and I'll keep you informed as it evolves here over the next, as the origination of it, I should say, evolves here over the next few weeks. I want to remind you of just the basics once again of COVID-19. While I told you that COVID-19 is, while I told you that we are now morphing, how we are adjusting to COVID-19, just as the state of Minnesota is, just as the nation is. COVID-19 is still amongst us, very clearly. So when we do make some modifications to our policies, there are certain things that absolutely are not going to change. For instance, the social distancing, staying at least 6 feet apart, that is not changing. Wearing our masks at all times, that is not changing. Staying within our zones as much as possible, that is not changing. Not crossing the zones. But you'll see the list of things that are changing, that we're recommending changes in, and sort of the requirements, the things we're going to change, the requirements that we have of you as well. So we can't ever forget the importance of those things that I just mentioned, and I didn't mention, but I'm now, frequent washing of hands, okay? So, but that social distancing, wearing of masks, frequent washing of hands, those are really key to limiting the spread. So keep that in mind. That is our best vaccine right now, no question. A reminder that today there is a bagpiper starting in our courtyard at 2:30 and then moving to our main parking lot, and then the bagpiper is going to, I believe, walk around the entire campus. So be watching for that action this afternoon at 2:30. So you should be watching me today, I think, on channel 6.1. If you're still on channel 6.0, you're not getting as good, you're not having as clear an experience as those that have turned to channel 6.1. So I think you should be experiencing a significantly improved system starting today. That is it for now. I look forward to seeing you tomorrow at 1:30. Take care.